It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, we're back. Our next guest, Dr. Welton, orthopedic surgeon, a specialist in sports medicine and hip preservation surgery, leading the hip preservation program for Multicare Health System, and also team physician for the women's Reign FC professional soccer team. Hip dysplasia, quick description of that.
Hip dysplasia is a malformation of the hip joint or a lack of configuration of the hip joint, and Dr. Welton can fix these and preserve your hip joints. That's new technology and good stuff.
Here she is.
Dr. Welton, welcome to Health Talk. How are you doing?
I'm doing great. Thanks for having me.
Thanks for joining us. I'm excited to talk to you. You have an emphasis in hip surgery and hip preservation. You're an orthopedic surgeon. I always like to start the show out kind of talking about your training, your interest, how you became an orthopedic surgeon, and particularly your interest in the hip. Let's talk about that.
Yeah, so I'm dually fellowship trained in both sports medicine surgery and then did a second fellowship in hip preservation surgery as well.
Okay, hang on. So our listeners, we've talked about fellowship, particularly with orthopedic surgeons, a lot. Now, just so they understand, you did 5 years of residency in orthopedic surgery.
Yep.
Did 1 year specialized in sports medicine where you learned about the shoulders, knees, ankles, all the sports medicine applications as an orthopedic surgeon. And beyond that, you did 1 more year just working in the hip.
Yep, that's exactly correct.
Why the hip?
Well, I think of the hip preservation as kind of the last frontier of growth in orthopedic surgery. It's a relatively new field in medicine and in orthopedic surgery, and so it's really exciting to be kind of on the front line of something that is so vital, and that we have a lot of opportunity to grow and learn and help treat patients better.
It's kind of interesting that the hip joint, we're going to talk about it anatomically here in a minute, but just for our listeners, again, to understand, this is like the last frontier, like you just described. It's kind of the last joint that you folks, orthopedic surgeons, really started scoping. I mean, if you go back 30 years and you had a problem in your hip, you got a total hip. There wasn't any preservation possibilities.
Yeah, that is so correct. Hip arthroscopy really didn't become mainstream until the 1990s. So yeah, it is just a burgeoning field. We're still learning a lot on how to perform better techniques, and it's just exciting.
It's a challenging joint. If we talk about the hip from an anatomical standpoint, what you have is kind of a ball that sits deep in a socket, and so not a lot of room to get instruments or scopes in there. So technique-wise, it can be challenging, I would imagine. I mean, that's a little bit of a learning curve there?
Yes, absolutely. And like you said, it's kind of the most deep joint in the body. And so in order to get there, it requires more than just simple arthroscopy knowledge or know-how, and that's why there are year-long fellowships for us to be able to master that, so that we can not only do reparative and reconstructive techniques within the joint, but also how to do it without damaging the structures around the hip as we're doing the work we do.
So, in your opinion, when someone says, I do hip preservation, what does that mean? Hip preservation. What are those areas of interest, areas of injuries, disease? What all encompasses that hip preservation kind of situation?
Yeah, so in the simplest terms, hip preservation is the diagnosis and treatment of pre-arthritic hip conditions. So as a hip preservation specialist, it's my job to help delineate if a patient has pain or injury to the joint itself, or do they have surrounding tendinitis or bursitis, or is the pain that they're experiencing actually coming from the back? But once the correct diagnosis is made, then helping to determine the best management plan for that particular athlete or sports enthusiast.
Wow, interesting. Let's talk about one of the areas that you probably see and get involved in is this word hip dysplasia. Hip dysplasia, probably some Latin word or root word there. What does it mean?
Hip dysplasia is basically a definition for when the socket is too shallow to appropriately house the femoral head or the ball of the joint. And so what that does is it causes over time increased stresses across the joint, and can lead to labral damage, cartilage damage, and we know that it's one of the leading factors that causes the development of early osteoarthritis.
Dr. Linnea Welton returns after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Back with more with Dr. Linnea Welton, orthopedic surgeon, talking about hip dysplasia on Como.
Dr. Welton, again, thank you for taking time to join us here on Health Talk. Dr. Welton is an orthopedic surgeon specializing in hip preservation. Part of that, we're talking about hip dysplasia. As a hip preservationist, when do I see you? What are going to be my signs and symptoms? What are my treatment options? I mean, let's cover that gamut. And you're really, really well respected in this field. I mean, I understand you're going to Madrid to speak. You've done some papers. So you've done a lot of research and quite involved in this area.
Absolutely. So getting right to the point with regards to signs and symptoms. So patients normally first start to experience pain. Usually it's in the front of the hip. It's usually a sharp stabbing type pain. As the hip becomes more irritated, they can start to have constant pain. So pain even with just sitting. Sometimes sleep is disturbed. Oftentimes clicking or catching can be experienced. And then with dysplastic patients, a shifting or clunking sensation in more extreme cases can also be what patients will describe to me.
And if someone shows up at your office with these symptoms, what do you have in your so-called grab bag of tricks for diagnostics? How do you diagnose this? MRI, X-ray, what's the best methodology?
Exam is really critical to getting a preliminary diagnosis. We know that a lot of patients with hip dysplasia also tend to be hypermobile. Based upon their hip range of motion, I can get a good idea as well if dysplasia may be part of the problem. I always get an initial set of x-rays of the patient's pelvis and their hip joints. And if that does lead to suspicion or confirmation of hip dysplasia, then the next steps down the road are certainly to get advanced imaging like a hip MRI. And then I always get a 3D reconstruction of a CT pelvis of that patient's specific hip so that I can get exact rotational abnormalities, how shallow the socket is, so that when I go on to plan their surgery, if that's what they need, I have an exact idea of what I need to do most accurately and most precisely.
So you talked about if you have to do surgery, what options do they have? Now you're talking about a small or shallow socket with a large ball, basically. What do you do surgically to help that? Yeah,
so every patient's surgical plan is unique to them. For some folks that have borderline or sort of very mild dysplasia, then potentially just hip arthroscopy alone can be the solution for them. And that hip arthroscopy is an outpatient surgery. It requires 2 small incisions about the diameter of a woman's finger, so small incisions. Yeah. And what I go in there and do is I repair the labrum, reconstruct it if I have to, and then recontour any bony problems. With regards to patients that have more severe hip dysplasia, then after the hip arthroscopy, it's usually followed a week later by a more invasive surgery called a periacetabular osteotomy. And that allows me to realign the socket so now it covers and contains that ball adequately.
So patients that have this, there are significant, well-researched options out there with good results.
Yes, and certainly that body of literature is growing.
Dr. Welton, thank you so much for your time. Great information. Thank you for joining us on Health Talk.
Thank you so much for having me.
That's been Dr. Linnea Welton. If you'd like to get more information, go to multicare.org. It's just another example, I think, Shannon, of a lot of stuff that comes around because of some athletic activity that sometimes can, exacerbate some of these injuries.
Absolutely. And it used to be, Tom, that if you had a hip problem, you just kind of lived with it, or you waited to have a total joint. New technology, they can go in and preserve that joint and give you longevity in that joint. Pretty fascinating stuff.
Dr. Joseph Marquez, our next guest on Como.